So we are going to demonstrate on the junior in here a technique to evaluate BPPV. Just a short explanation before, we have what we call in the inner ear, we have semicircular canal. That's canal that sits like this, okay? We have, that's called the posterior canal, and we have also horizontal canal. We have another form of canal which is not important for the BPPV. Now, what I'm doing, the most common form of BPPV is crystals that actually going into the canal, and that's what causes the spinning sensation. And usually these crystals will go to the posterior canal, which sits like this, 45% angle. So what we are trying to do is to move his head in a way that the crystal will go back to where it belongs to. The test that I'm going to perform, called the heel pike, it's not a treatment, it's just a diagnostic. And what I expect to find is something that's called nystagmus. Nystagmus is a big word that describes eye movement. Now, to this nystagmus may have a lot of forms. We're looking for a specific pattern of nystagmus. That's why it's very important that the patient, in this case my son that doesn't have any vertigo but will still do it, will keep his eyes open. Even if you feel a lot of dizziness, a lot of vertigo, I'll ask him to keep his eye open and look at my nose. And what I want to see is if his eye is moving in this kind of way spontaneously. So we are turning the patient's head to the direction of the canal that we want to test. There is one in each side that is relevant for this kind of test. And then what we're doing, we ask him to lie down backwards. We always give him support and keep his eyes open and look at our nose when you reach the final position. So we are counting 1, 2, 3. We're extending his head a bit, look at my nose, and what we are searching is a specific eye movement that's called nystagmus. This cute kid in here doesn't have any nystagmus, and we have to stay in this position for about 30 seconds. People that actually suffer from posterior canal BPPV will have a very, very significant, usually vertigo on this position. We repeat this test to 2 sites in order to determine on which canal is the problem. And based on this, we're doing our treatment. And now we ask him to sit back. And it's very important to stand next to our patient even after he sits, because sometimes the dizziness can start after he returns to the sitting position.